My name is Gabrielle Anding, and today I will be presenting to you all chronic kidney disease. What is cell-to-cell communication? Cell-to-cell communication is the transfer of information from one cell to another. In cell-to-cell communication, there are two types of signaling, local and long distance. Long-distance signaling is a type of cell communication whereby the signaling molecules act on a target cell that is far from the signaling cell. Local distance signaling is when cells that are close to one another communicate using signals. There are three steps in cell-to-cell communication, also called the signal transduction pathway. The first step is reception. A cell detects a signaling molecule from outside the cell. The signal is detected when a chemical signal, aka ligand, binds to receptor protein on the surface of the cell or inside the cell. I love you. Please work.
You have to say it nicely.
I love you.
Mean it. I love you.
Transduction is the second step. When the signaling molecule binds to the receptor, it changes the receptor protein in some way. This change initiates the process of transduction. Signal transduction is a process that happens in several steps. Each relay molecule in the signal transduction pathway changes the next molecule in some way. The last step is response, and finally the signal triggers a specific response, cellular response. No. I love you. Please.
It doesn't feel it. I love you.
I love you.
Beating heart.
What is all this mess?
Put the X.
Okay, there. Okay, now I love you.
I love you. I love you. Please.
Look, if it gets stuck, just do this.
I'm sorry.
That's all right. Your hands are probably cold. Is that it, Mom?
Yes, that is the next.
Okay.
This is the anatomy of the kidney and nephron. The most important part to know about the nephron is the glomerulus because it comes in handy a lot in this. Normal functioning kidneys. The renal system, which consists of kidneys, ureters, bladder, and urethra, serves as the body's water treatment plant by collecting the body's waste products and expelling them as urine. It also filters electrolytes. The kidneys are located on each side of the vertebral column in the upper abdomen outside of the peritoneal cavity, about right here. These compact organs contain an amazingly efficient filtration system. They filter about 45 gallons of fluid each day. The byproduct of this filtration is urine, which contains water electrolytes and waste products. Normal functioning nephrons communicate through local distance signaling. I love you.
Just hit the button.
Oh yeah. What is kidney disease? Chronic kidney disease, also known as chronic renal failure, is a gradual loss of kidney function. This happens in 5 stages. The first stage being mostly functional with 90% or higher, and the stage 5 being close to complete kidney failure, 15% or less. When kidneys are not functioning correctly, waste cannot be filtered out of the body, causing problems for the person suffering from this disease. Kidney damage is irreversible, so kidneys that have been affected will only work to the capacity that they are capable of. If the kidney damage becomes too severe, the kidneys will stop working altogether. No. Signs and symptoms of kidney disease include nausea and vomiting, muscle cramps, loss of appetite, swelling via the feet and ankles, dry itchy skin, shortness of breath, trouble sleeping, urinating either too much or too little, pain in the small of your back, puffiness around your eyes, abnormal levels of phosphorus, calcium, and or vitamin D, high blood pressure, irregular heartbeat, foamy or bloody urine, and constipation. Why is kidney disease a cell-to-cell communication disorder? In chronic kidney disease, the nephrons, the cells of the kidney, die. Inside of the nephron, the glomerulus, tubules, and the arterioles are damaged. The nephrons are dead, so they can't go through the signaling transduction pathway, meaning they don't even make it through reception. It is found that NPY is produced in the podocyte of the glomerulus, and the production of this decreases in renal disease. In the glomerulus, NPY signals the NPY receptor to NPY2R and modulates PI3K, MAPK, and NAFT. signaling along with RNA processing and cell migration. Since the cell stops making MPY in renal disease, it cannot signal MPY to R, and therefore cannot modulate MAPK and PI3K, MAPK, and NAFT, and will eventually lead to nephrotoxicity. This is where reception occurs in the signal transduction pathway, but it doesn't really occur because the cells are dead. And basically, since the MPY cannot signal MPY to R, it cannot keep those three things in control, and they'll work too hard, causing nephrotoxicity, which will eventually lead to kidney damage and kidney disease. The many causes of kidney disease include chronic glomerular disease or glomerulonephritis, chronic kidney infections, tuberculosis, polycystic kidney disease, hypertension, nephrosclerosis, which is the hardening of the kidneys, kidney stones, collagen diseases such as lupus, nephrotoxic agents, and endocrine diseases such as diabetes. Diabetes. Diabetes is the leading cause of kidney disease. About 1 in 3 people who have diabetes have kidney disease. Kidney damage caused by diabetes usually occurs slowly over many years. Diabetes causes high blood sugar, which damages the blood vessel clusters in the kidneys as well as the nephrons, causing them to not work as well. The condition slowly damages your kidneys' delicate filtering system. This causes waste to build up, further damaging the kidneys and causing other health problems. This can lead to diabetic nephropathy. Healthcare professionals use blood and urine tests to check for diabetic kidney disease. They check for albumin in the urine, which is a protein in the urine, and will also do a blood test to see how well the kidneys are filtering the blood. Many people with diabetes also develop high blood pressure. Hypertension, also known as high blood pressure. The tiny hair-like capillaries are damaged from hypertension, causing nephrons to receive inadequate oxygen and nutrients. Then the kidneys lose their ability to filter blood and regulate fluid hormones, acids, and salts in the body. This makes the kidneys fail to regulate blood pressure, exacerbating the disease. Reception is the pathway that does not work in kidney disease because the nephrons are not receiving adequate oxygen and nutrients required for communication to occur in the first place. Peritubular endothelial cells are positive cells of the kidney. These cells undergo apoptosis and are destroyed. This causes peritubular rarefaction, which is the loss of vascular density, and it also increases tissue hypoxia, which is when there is not enough oxygen present to maintain homeostasis. Oxidative stress also occurs from this, and oxidative stress is also when there is not enough oxygen in the organ to maintain homeostasis. Kidney stones. In the early 1900s, kidney stones were the leading cause of kidney disease. Stones made of calcium oxalate and or uric acid would build up in the kidney. These stones would either stay in the kidney and cause a blockage, or they would try to pass through the ureter and cause a blockage there. These blockages would cause a buildup of wastes and eventually damage the kidneys. The treatments of kidney disease include dialysis, lithotripsy, Jardiance, healthy diet and exercise, blood pressure control, and, if all else fails, complete kidney transplant. Dialysis. Dialysis is used to clear all of the built-up wastes in the blood. Patients who have end-stage kidney disease must undergo dialysis. Patients have to have an access place to do dialysis. It is either placed in the chest, or if you're doing peritoneal dialysis, it is placed in your stomach. Patients undergo dialysis 3 times a week for 3 to 4 hours at a time. This gets all wastes, extra electrolytes, and fluids out of the bloodstream. Dialysis patients must be very careful with their diet and restrict their fluid intake so that it does not overload their body in between treatments. Missing a treatment is also very dangerous for dialysis patients because the fluid and electrolytes can quickly build up, and it's sometimes hard to come back from. Lithotripsy. Lithotripsy uses sound waves to make a shock to break up kidney stones. People giving lithotripsy to a patient must wear lead vests to protect themselves from radiation. They use an x-ray to find the stone, and using a 3D centering that comes to a cone around the stone. This is basically like a target that locks onto the stone, so they know exactly where to send the sound waves. The machine used was created during World War II by Dornier and is still used today. The machine hits a bag of water to make a constant beating of energy to the stone. This eventually breaks the stone into smaller pieces, allowing it to pass. Before using lithotripsy, they insert a stent to try and pass the stone, and if this does not work, they have to use lithotripsy. A stent can also be placed post lithotripsy to help pass the pieces of the stone and to prevent excess pain or further blockage. Oh yeah, on to it. There are genes that are associated with chronic kidney disease. They are GPX1, GST01, UMOD, and NGP. GPX1 is located on chromosome 3, GST01 is located on chromosome 10, and UMOD is located on chromosome 16, NGP is located on chromosome 12. And thus concludes my presentation on chronic kidney disease.